all on Health Sense.
This program was provided by Cleveland Clinic, Florida, and generous viewers like you.
Hello, and welcome to Health Sense. I'm Chris Curl. Mental health is a complex issue, and often people are afraid or even embarrassed to discuss it openly, even with family or close friends. According to the National Institute of Mental Health, an estimated 22% of Americans suffer from a diagnosable mental disorder. That's about 1 in 5 adults. While depression often is one of the first things you think of when talking about mental health, eating disorders may be among the last. We don't always consider disorders such as anorexia, bulimia, and binge eating as being mental health problems. But experts are quick to clarify that eating disorders are not due to a lack of willpower. They agree that these disorders are real and treatable medical illnesses.
Eating disorders are grouped into 3 categories. Anorexia, which is refusing to maintain a normal weight. Bulimia, which is defined by binging and purging. And binge eating disorder, which is the rapid consumption of large amounts of food in a short period of time without purging.
We have to impress upon everyone that it's so much more. It's that person inside and that feels like they're dying and that no one understands them.
Stephanie Ingram is the of nursing at an internationally known eating disorder and substance abuse facility in Naples, Florida.
I see 90% of the patients have some type of personality disorder, whether it be borderline personality, narcissistic, antisocial, there's so many different types, but primarily there's always some kind of personality disorder that has to be unraveled.
Stephanie explains why eating disorders are considered a mental health issue.
It's all really the same. I mean, you're hurting inside and, what's going to make that come out? You want to be understood, like you feel empty. No one would ever choose to live a life like that. I mean, no one would ever choose to consume themselves with thoughts of their body image. It's very exhausting. It's very exhausting, and, it's just, you don't really have a life. And maybe I could say that to someone who didn't really understand that no one would choose that.
And Stephanie's insight isn't just from working in a treatment facility. She battled eating disorders herself through most of her young and adult life.
All through high school and college, I had my own issues with, an eating disorder. And, I feel very strongly about not going into specifics about, like the behaviors and, my lowest weight and things like that, because I know myself that when I was in the disease that I would seek those things out. Like you actually, thrive off reading about it, seeking out movies and articles and anything you can get your hands on.
People who suffer from eating disorders often suffer from other psychiatric disorders, such as depression and anxiety. And it's important to recognize the psychological component to successfully treat these conditions.
How they feel about themselves. And also has to do with how they see themselves in society, if they're not good enough, if they have a lot of guilt. It is a way food becomes as a tool of punishment. If somehow they feel empty emotionally, they will fulfill that with food.
Dr. Lado counsels eating disorder patients and explains another reason these illnesses are considered mental health issues.
Once you start this behavior of anorexia, purging itself, when you purge, you have a rush. You get high. It's a euphoria. Why? Because of dopamine. So every time you purge, you get this incredible release of euphoria. So after a while, it becomes a mechanism where you have to do it again, an addiction. In fact, these disorders are now being classified as addictive disorders.
It's even been reported that stopping the binging cycle is as difficult as recovering from cocaine addiction.
50% of the eating disorder have a cure, 20% are relapsing, and 30% they have a chronic course.
Certain psychological factors can predispose people to developing eating disorders, including dysfunctional families or relationships, and traumatic or abusive events. And personality traits also may contribute to these disorders. Most people with eating disorders suffer from low self-esteem, feelings of helplessness, and intense dissatisfaction with the way they look.
I do know if I can help it when their mood, be either anxiety, stability, it gives the brain an opportunity to think clearly. Because what you do is you control a very chaotic mental environment. When you do that, you give them a sense of internal organization and hopefully a sense of purpose.
Early intervention is vital to successfully treating eating disorders, and recognizing some warning signs is the first step. These can include a preoccupation with weight and food, excessive exercising, difficulty eating in public, and of course, a drastic change in weight. Someone suffering from an eating disorder is not likely to seek out help themselves, and most often it's up to a loved one to intervene. And without intervention, the consequences can be dire. Bulimics often suffer from dangerous irregular heart rhythms and dehydration, and an estimated 10 to 15% of anorexics die from self-starvation or suicide.
There was a person that I know has been, she had been dealing with this for a long time, and I just found out that she took her life. And I said to my friend, people do attempt suicide, and this particular person had before and now did succeed. And I said, do you really think that she wanted to do it this time? And he said, no, Steph, she just wanted to be understood.